The novel coronavirus has rapidly grown into a global pandemic in just the last week alone. The timing couldn't be more critical, in the midst of a US primary election with two candidates separated by a mere 154 delegates. What is most striking is how vital elements of the Sanders Medicare for All plan are now being enacted by the US government in a time of crisis, such as free screenings and the proposal of paid sick leave.
We have millions of people who may be dealing with the virus, but who cannot go to a doctor because they cannot afford it. That is a question that must resonate in every American's mind. If this isn't a red flag for the current dysfunctional and wasteful healthcare system, frankly, I don't know what is.
There's never been a more clear distinction between the two candidates' positions than when it comes to their proposals for Medicare for All.
And, by the way, Joe, under your plan, you asked me how we're going to pay for it. Under your plan, I'll tell you how we're paying for it right now. The average worker in America, their family makes $60,000 a year. That family is now paying $12,000 a year for healthcare, 20% of their income.
Bernie not only endorses it, he designed the bill, and Biden opposes it.
If they got that through and by some miracle, and there was an epiphany that occurred, and some miracle occurred that said, okay, it's passed, then you got to look at the cost. I want to know, how did they find the $35 trillion? What is that doing?
Other countries with similar public healthcare systems, such as Canada, are already faring far better than the US. The University of British Columbia has reported that a single hospital in Vancouver, BC, has already performed as many screenings as 43 states in the US have in total. Bernie has been emphasizing the need to make healthcare for all Americans in every televised appearance he has made.
We are the only major country on earth not to guarantee paid medical leave. So if you can believe it, there are people who are sick today who may actually believe they have symptoms of the coronavirus who are going to work because they have no income. They're making $12, $13 an hour. They got to feed their families. They go to work. We have got to do what every other country on earth does and guarantee paid family and medical leave, and do it right now on an emergency basis.
Their messaging could not be more different on an issue this critical.
Funding that would provide for no hidden bills, et cetera. And I can get it done quickly, and people will be covered. But even I can't do that for another a year between now and November, or actually January. Any factories or anything within 1 mile of the estuary of the Delaware River and the Atlantic Ocean and Chesapeake. And so the whole point of this is that we can do a lot to deal with endangered species. And one of the things I would like to raise is that we have to deal with this on an international basis as well. Because right now, for example, we have a thing, Brazil has the Amazon is burning because they're trying to clear the Amazon in order to make money in agriculture. What I'd be doing is organizing the entire world to say, stop now, stop doing that. We will pay you $20 billion no longer to do this because you have an opportunity to be able to